the media is worried about that, obviously. You guys really love that. You don't care as much if it's a, quote, peaceful protest, and then it's fine. You don't care as much if they're celebrating a Biden election. You only care about if it's people that you don't like. So I'm a Bucks fan. I'm damn proud of what they did on Sunday night. And so in terms of the UK variant, here's what we know. We know, based on all the evidence, that these vaccines are going to be effective against that. And that's really the main concern. I mean, we're getting our seniors vaccinated. We've not seen any data or any evidence to suggest that these vaccines are not effective. And so if we get the seniors vaccinated, we're going to be good, and that's what we're going to do. If there's data that comes out, not an academic model from Neil Ferguson, but actual data that comes out that we should let people know about, or that should change the approach of vaccine, or any of that. Obviously, you're going to follow that and see. But I can tell you most of what I've seen about it has been more based on modeling rather than based on actual evidence. And again, the vaccines, there's not been any problem demonstrated with the vaccines. And so that was my main concern with it. And I think we're going to be in good shape there. If something changes, we will let you know. Yes, ma'am. Well, we want to. I want everything done as quickly as possible. We obviously were able to expedite a lot of projects over COVID, and I think that saved probably months worth of traffic across the state. And we want to continue to do it, but the DOT knows that that's what we want to do, and we're going to find every way to do it quick. Yes, ma'am. Yes, sir. So the question is how do you ensure these are folks that are local? Well, two ways. One is these names were put together through the county. So they got county folks. They did it. It was ready to go. They had the names. People were signed up, and all you do is show up and do it. In the broader question, we've said we're not doing vaccine tourism here. I can tell you that behind the scenes, we've gotten pushback from CDC on that. They don't believe you should have to show ID or anything like that. I'm sorry, in Florida, we want to know that you're a Florida resident. You could be a half year, because that's a lot of people come here for half year. We get it. They got doctors here. But we don't want people traveling from out of state or out of the country even to be able to do it. We want to focus on the folks that are our friends and neighbors, and I think that's approach. But we do. Are you 65 and up? And then are you here? Here, because it was done through the county, I don't think there's going to be a problem with it. With the public sites, I don't think that's going to be as much of a problem either. We obviously are doing the Florida residency for that. Initially, when we only had it in like 10 counties, we'd have people drive hundreds of miles just to go to a Publix. That was not really the intent. I mean, obviously, they're free to drive if they want, but because there's so many retail sites now across the state, then it's something where you pretty much have access. Most, I would say probably 80 to 90% of the counties have a retail site that's relatively close. Now, some places, Venice, it's going to be great because you're going to have 4 or 5 right here. Palm Beach County, there's 60-some Publixes in Palm Beach County that's doing it. 90% of all seniors live within 2 miles of at least one Publix. And so that's what you're looking to do. This way, you don't have to even think about driving across the state. But in terms of out of state, people that are just visiting, tourists, not doing it. I will say, though, the fact that someone would even think about coming here from Brazil or from South Africa or wherever to come to Florida, it kind of blows up any fake narratives that somehow seniors aren't getting shots here. Because if they weren't getting shots here, no one would want to come to get shots here. They see people doing it. Seniors here are getting shots. They're telling their friends in these other states, hey, I just got it. And they're saying, well, wait a minute, you're 69, I'm 69, I'm not even eligible in my state with that. We said 65 and plus since as soon as we did the healthcare workers and we had nursing home program, we said we've got to get into 65, and I think that was the right thing. Yes, ma'am.